Hello, everyone. My name is Dr. Marianne Gausche-Hill. I'm the medical director of the Los Angeles County Emergency Medical Services Agency, professor of clinical emergency medicine and pediatrics at the David Geffen School of Medicine. I'm also clinical faculty at Harbor-UCLA Medical Center in the departments of emergency medicine and pediatrics, and senior consultant for the EMS for Children Innovation and Improvement Center. And today I'm here to talk to you about a topic that we've all had to face with the increase in behavioral health conditions that we're seeing, especially in children. So the title of my talk is Safe Control of the Agitated Pediatric Patient. In regards to disclosures, as I said, I'm a senior consultant for the EMS for Children Innovation and Improvement Center. And this is funded through HRSA HHS, and you see the award there. And I need to state that the contents are those of myself and do not necessarily represent the official view of nor endorsement of any of the federal agencies, including HRSA, HHS, or the US government. So thanks. Here we go. So we're going to start out with some of the resources that are out there. And this is a great algorithm that can be incredibly helpful, along with additional resources that are at the site. And we'll have a QR code at the end so you can click onto it. But this is by the EIIC and TREC, which is Translating Emergency Knowledge for Kids. As you can see, the algorithm starts out in recognition of agitation, some of the initial strategies like de-escalation and calming, and then it moves to what is your assessment? What do you think is going on? And potential pharmacologic interventions, if indeed those are necessary. So now let's move to assessment of the agitated patient. And so some of the questions you're trying to ask, or ask enough so that you can solve some of these things. Is it delirium? Is it substance intoxication, withdrawal? So you're going to need to ask about that. Does the patient have an underlying psychiatric diagnosis? Are they developmentally delayed? Or is this unknown? And we're going to come back to this because this is really critical in terms of some of the interventions. So why is this patient agitated? Are there some kind of trigger? Sometimes it's environmental trigger. I had a child that was really, really worried about a potential for nuclear weapons to be used, as an example, by the Russians. And he was worried about that and became so anxiety-ridden that he really could not control his own behavior. And so that it can be a trigger like that. It could be a trigger in the environment, especially for those who are developmentally delayed. They may be too hot, too cold, that type of thing. I think one of the most common triggers that I see is interpersonal. They got a fight with their friend, their boyfriend, their girlfriend, their parent, a caregiver, their teacher at school. Those are probably the most common. And so having an understanding, because if you can address a way for them to handle it better, sometimes that helps them calm down. And then finally, medical. Is there anything, pain? Is there some type of systemic illness that's causing it, or an injury that has resulted in it? The other thing is just understanding the past medical history. I mentioned in the previous slide about, developmental delay or psychiatric diagnoses. This is really critical. So the timing of this, so it's really helpful to have collateral information. And again, it could be from the school, the sister, the brother, the mother, the caregiver, etc. That is really, really helpful to understand what is different now, what is the time course. And so understanding that also in the context of their previous psychiatric history is really helpful. Do they have a previous history? What has been done in the past? What meds are they on? And also if there's been any ingestion. So are they abusing substances, which could also trigger and make them really less able to handle any stressor. Besides those very specific for behavioral health and psychiatric crisis, we have to think about our standard assessment to see if there's any underlying medical conditions, such as being treated for cancer, as an example, on chemotherapy, or what other potential have they had UTIs in the past? Could this be sepsis? So those kinds of things are helpful. And allergies, of course, and then some ideas on development. Are they developmentally delayed? And I think getting an assessment, if they're developmentally delayed, have they lost milestones? What's different now is very, very helpful to try to rule out organic causes from psychiatric causes. And then focus history and social history, who lives in the home. And again, any recent events at the home that could be a trigger, such as a death in the family. I think utilizing the resources such as the EMS for Children Innovation and Improvement Center and TREC tool. Here's a QR code that's going to link you to the resources that you need, that EIIC algorithm, which I think is really helpful, and the medication table. I personally want to acknowledge Drs. Patrick Kelly and Eric Chung for their assistance with me as I developed this talk for you. And obviously the wonderful expertise of the EMS for Children Innovation Improvement Center and TREC for them really coming together to collaborate on these resources that will help you take better care of your patients. Thanks for listening. You can email me at mgausche-hill@dhs.lacounty.gov or on Twitter at mgausche-hill. Thanks so much.